Hello friends, welcome to AI Medical School. In this video, we will talk about the Diclofenac drug, but before starting the video, if you haven't subscribed to the channel, subscribe to it and like the video. Table of objectives, overview, indications, side effects, warnings, dosage, and brands. Let's start with the overview. Diclofenac is non-steroidal anti-inflammatory drug. Diclofenac is a simple phenylacetic acid derivative. It resembles both flurbiprofen and meclofenamate. It reduces fever and inflammation and relieves pain. Indications are: Diclofenac is primarily indicated in conditions like acute exacerbation of pain and post-operative pain, acute gout, ankylosing spondylitis, bursitis, gastroesophageal reflux disease, juvenile chronic arthritis, low back pain, musculoskeletal disorders, osteoarthritis, peptic ulcer, periarthritis, pernicious anemia and other macrocytic anemias, post-operative pain, prevention of post-operative pain, rheumatoid arthritis, sprains, strains, tendinitis, tenosynovitis, tobacco amblyopia and Leber's optic atrophy, and ureteric colic. Contraindications are: Diclofenac is contraindicated in conditions like asthma, peptic ulcer, hypersensitivity, guide bleeding, renal impairment, hemorrhagic diathesis. Now the side effects. The severe or irreversible adverse effects of Diclofenac, which give rise to further complications, include anaphylactoid reactions, nephrotic syndrome, blood dyscrasias, peptic ulceration, bleeding, lower gut disorders, and papillary necrosis. Diclofenac produces potentially life-threatening effects which include blood dyscrasias, perforation of peptic ulcer, anaphylaxis, and GI hemorrhage, which are responsible for the discontinuation of Diclofenac therapy. The signs and symptoms that are produced after the acute overdosage of Diclofenac include nausea, vomiting, melena, jaundice, unconsciousness, dizziness, headache, hepatopathy, oliguria or anuria, myoclonic encephalopathy, GL hemorrhage, somnolence, upper abdominal pain, and hiccup. The symptomatic adverse reactions produced by Diclofenac are more or less tolerable, and if they become severe, they can be treated symptomatically. These include flatulence, dizziness, vertigo, tiredness, headache, drowsiness, irritability, nausea, vomiting, anorexia, diarrhea, anxiety, tremors, abdominal cramps, constipation, insomnia, rashes, pain, itching, burning, dyspepsia, depression, nightmares, epigastric pain, taste disturbances, eye irritation, paresthesias, vision disturbances, hearing disturbances, and ulceration of conjunctiva and cornea. Warnings are: Diclofenac sodium should be used with caution in patients with intrinsic coagulation defects and those on anticoagulant therapy. It should be used with caution in patients with compromised cardiac function, hypertension and other conditions predisposing to fluid retention. It should be used with extra care in the presence of existing uncontrolled infection. Perform periodic auditory, hearing, function tests during chronic therapy. Discontinue drug if skin reaction occurs. High-risk groups are: drug should not be given to pregnant mothers, cardiac or hypertensive patients, and patients suffering from kidney dysfunction. If prescribing authority justifies the benefits of the drug against a possible damages, he or she should re-evaluate them and consult the reference material and previous studies. Now the dosage. The adult dose is 25 to 75 mg, frequency 12 hourly, route, ophthalmic, anophthalmic dose is 0.05%, oral, administer orally after food. Frequency may be increased to 3 times if needed, and DPIM, for maximum 2 days, continue with tabs if necessary. If needed, frequency may be increased to twice per day. Now the pediatric dose is 0.25 to 0.75 mg per kilograms, frequency 6 hourly, route, oral. Now brands are Diclozaf, Voltaren, and Caflam. Thanks for watching. I hope you guys liked the video, and I really appreciate your love and support.